Dental implants are a permanent tooth replacement solution that allows patients to smile with confidence and eat the foods they love without having to worry about a thing. Dr. Graves from AOMS joins us today with more about this procedure. And as we were kind of looking at the graphic as we're going to the teas, there's three different parts to this, right?
You know, there's three parts to like restoring like a missing tooth. The first is the actual implant, and the implant is what people would refer to as the screw. So that goes into the bone, and then on top of the implant is something called an abutment, which is what the crown, which is the third part, fixes to, that goes on top of the abutment.
Okay.
So typically, you know, an implant, when you place the implant, you can't get your permanent tooth the same time. And that's simply because the bone is still a little soft where you place the tooth, the implant, and it takes a couple months to heal. And if you wanted to think your bone of kind of like concrete,
right,
you put something in concrete, you have to let it heal before you start climbing a fence or whatever it is that you may do. You know, your bone is kind of the same way. The crown and the abutment come at the end, which is, you know, somewhere between 2 to 5 months from the time of the surgery.
So initially when you go in, one of the great things about this, and we've seen it happen with a member of that works here at KMR Local 4 about going in and getting this one of these done, is you go in and you walk out with a brand new smile. Yeah,
and there's completely different things. Like we have the all-on-4, the 4-hour smile that you're referring to. That's a big radical surgery that we do. I mean, that is a full mouth reconstruction. And then we have people who are just, you know, missing one tooth. They're missing a molar. They just want to replace one tooth. And, you know, that's the two different things that we're talking about here.
And so you can go in if you've had a traumatic injury, and maybe a wreck or something, or you've had a tooth out, you've had it out for years. You don't have to live that way. Yeah.
You know, probably the most common questions I get when I go in and see a patient for their consult is, you know, how much is this going to hurt? Yeah. How long is this going to take? And when can I go back to work? What's the recovery time? You know, and today, I mean, really, we do a lot of things differently than maybe what happened at your dentist 10 years ago. Yeah. You know, our goal is to get you back to work and get you, you know, free or reduce pain as much as possible so you can kind of go on with your life. And I'll tell people that, you know, there's two ways of having the implant placed. You can either be completely asleep or you can be completely awake. The people who choose to be completely awake, I mean, I could do the implant at 9 o'clock in the morning and then they could be at work that afternoon if they want to, in no pain whatsoever. Right.
Wow, it's incredible how far technology has got us. And that three-part design really, there are a lot of benefits to it.
There is. It gives strength and integrity to the implant, you know, by simply waiting 3 months. Now, if we're talking about maybe your front tooth that got knocked out, obviously you don't want to go for 3 months with missing your front tooth. Right. So we do have options with that. You know, we can place temporaries on the implant. You know, we may have to modify your diet a little bit, but you know, there are solutions for people who don't necessarily want to walk around missing their front tooth, which is the majority of people.
And it really is kind of different with each patient that comes in. There's just not a one-size-fits-all. It just on what it is for each patient that comes to the door.
You know, everything's custom these days. You know, we have custom CT scans, we have custom surgical guides, we have custom teeth. You know, we more customized to the patient. There's no cookie cutter when it comes to implants these days.
And I want to tell our friends at home, this is not a complicated procedure. You guys can, it happens, you guys do it relatively, it doesn't take a lot of time, and it is something that you can do just the consultation and the exam. How would they go about setting that up?
You know, it's simple. You know, just simply call the office. The number's on the screen right now. You can set up a consult. The consult is relatively quick. I mean, there are some complex cases that take longer, but think of being there somewhere between 30 minutes to an hour. You know, and then we can kind of go through your case and see what you need to have done, customize the case to you, and then if you want to schedule, then we can do that at that time.
And if you haven't figured this out yet, because we talk to Dr. Graves and members of AOMS all the time, you guys do just about everything, just a little bit of everything over there. You guys get it done.
That's right. That's what we try to be, cutting edge here, right?
Cutting edge and getting it done. All right, very good, Dr. Graves. Thank you. Up next, the Bridge Children's Advocacy Center provides comfort and trust.